Hi, everybody. My name is Jennifer T. Arena, and I just wanted to take a moment and introduce myself and my new YouTube channel. So, my passion in life has been really twofold. It's been healthcare and education. And over the years, I've done many different jobs in the medical field. I worked in a nursing home, I've done home health, I've worked in a small doctor's office with just one doctor, I've worked in a large practice that had multiple doctors, and I have also worked in an ER. For the most part, my tasks have been that of a medical assistant, registered medical assistant. But I also went to school and got my limited scope X-ray degree, and I've done X-ray as well. The other passion that I've had for a long time in my life is education. In fact, after my many years working in the healthcare field, I actually went to work in a career college where I taught medical assisting and X-ray as well. And I love watching people learn. When I was in my mid 20s, I took a break from healthcare and actually owned a daycare center so I could be with my children for 24/7. Um, and that's where I really, realized how much of a passion I had for education. And I was so happy whenever I was later able to transfer that and join that with the healthcare and do adult, education in the healthcare field. So one of the things, having said that, healthcare and education being my passion, one thing that I am also very passionate about is health literacy. And really, what health literacy is, it's not like regular literacy or ability to read and write and do numbers. Health literacy is really about the ability to understand what a doctor has said or what a medical person has said to you, understanding the directions that you're given before a procedure, being able to assimilate and really understand what they said to you during a visit. So, I talk to a lot of people all the time, um, and this really came to light with my mom, who's a smart lady. She was a paralegal, but when my dad got really sick, he had what's known as a AAA, an abdominal aortic aneurysm. He had a very long surgery, and had a very long recovery. And the doctors would come in and they would talk to her. They would ask her questions, and she would kind of, yeah, yeah, okay, yeah, okay, that sounds good. And then when they would leave, she would turn around and she would ask me, what did they say? Because she didn't really understand what they said. She understood the words that were coming out of their mouth, but she didn't necessarily understand the mechanics behind what are they really saying or the inferences that they would make during their conversation as far as diagnosis and prognosis and that kind of thing. And so that's where really, you know, health education really started coming into play for me because I did that for my mom, I did that for my family, and I was like, well, I want to do this for a lot of people. So that kind of brings us to where we are today. So if you've ever done that, if you've ever gone to a doctor's appointment and when you left, you thought, I didn't ask all the questions I meant to ask, or I'm not really sure that I understand everything that the doctor or nurse told me, or I'm really not sure what this medication that I'm now being prescribed is going to do for me, don't feel bad. You're not alone. Um, you are actually in the vast majority of the population born and raised right here in the United States. A lot of people don't really fully understand those things. So there's basically three levels that we're going to talk about when it comes to health literacy, and that's basic, intermediate, and proficient. And the proficient really, most people who are right now currently proficient either fall into one of three categories. They work in the healthcare field, or they have had a lot of medical procedures, spent a lot of time in doctor's offices and done a lot of valid research, or they know someone who falls into one of those two categories. That proficient number represents 12% of the population. So that's a fairly small number. Basic, that's, basic understanding, basic health literacy, that's 36% of the population, and intermediate is 53%. It's the broadest category. It also houses the most people. So, what that translates to, studies were shown that that basic category is about 90 million people. So, if you feel like that's where you fall, you're certainly not alone. You're with 90 million other people, and that's great. And if you're watching this, then you know that shows that you are wanting to have a better understanding. And studies have also shown that when more people have a higher health literacy skills, it's less taxing on the healthcare system, because they understand this is when I need to go to the doctor, this is what kind of doctor I need to go to, this is when I really need to go to an ER versus when I might just need to go to a walk-in clinic or urgent care and that type of thing. So when more people are using appropriate healthcare venues for what they have going on, then everybody gets better healthcare service, because it's less time to wait in the waiting room. That's less time exposed to people who might be really sick when you're there for something that maybe could be handled in a walk-in clinic, urgent care, or even maybe sometimes just a phone call type situation. So that's it for my introduction. Welcome to my YouTube channel. Please like, share, subscribe, tell your friends. As a note, I'm not a doctor. Nothing that I say in this series is meant to diagnose or be a recommendation for a treatment. If you have any questions, always, always, always refer to your healthcare provider, especially, since they know your medical history, et cetera, et cetera. This series is simply meant to increase health literacy and have people have a better understanding and have a better, more positive experience when you do go to the doctor's office. And so this series is, although I may talk about particular diagnostic tests, I may talk about at some point specific diseases, disorders, we may talk about over-the-counter medications, vitamins, and supplements, but none of that is meant to be a recommendation. It's just simply information sharing. So thank you for tuning in, and I look forward to interacting with you. I do mean for this to be interactive, and so if you have questions, email me, message me, and I will always do my best to answer those for you. Thanks so much, and have a blessed day.